Polio is just one of the challenges facing World Health officials. Joining us to talk more about those challenges is Ambassador Morten Weltand, the permanent representative of Norway to the United Nations here in New York. The government of Norway, by the way, has been outspoken in its calls for improved health care for mothers and children, especially in lesser developed parts of the world. Ambassador, thank you very much for joining us.
Glad to be here.
We just heard about this very aggressive campaign by UNICEF to immunize 20 million children over a month against polio. First of all, is that feasible, and will it have a dramatic impact on the disease?
I hope it's feasible. It sounds very ambitious to do that in 1 month, which we have not achieved in the 10 years behind us. But it means, of course, that UNICEF is aggressively pushing this agenda forward. When they succeed, as I hope they will, it will have a tremendous impact, because you will have saved, if you immunize 20, let's say 3, 4, 5 million young babies from dying unnecessarily.
So that's a wonderful return on your investment.
That's a fantastic return. It's one of the best returns. I mean, it would be the dream of any investor to have that kind of return on his capital. Relatively
cheap, inexpensive?
Very relatively cheap. You can immunize a child against most diseases for $20.
Well, you know, if we could do that, if that's true, and most of the world's pandemic diseases, let's say, could be handled either through immunization or other low-cost measures, and I'm talking about malaria, where you could use mosquito netting, and also improve sanitation. Those are all simple steps that can make a big impression?
Very simple, and it's possible to do it today. There's absolutely no reason why we shouldn't be able to eradicate malaria. And the US has been done a fantastic job in that respect. We are partnering with you through the World Health Organization, of course. And I think a mosquito net costs less than $5.
So why isn't it more widely done? Why
only because people like, well, not you and me, of course, but others do not think it's important enough to allocate enough finance and organization to put it into a system that reaches everybody. Things that you and I take for granted in our own countries, that our kids are immunized as a matter of course, is not self-evident throughout the world. Regretfully, it could be at a very low cost.
We tend to think that when it comes to global health issues, this requires massive planning and technology and a lot of money.
The technology is relatively simple, and most vaccines are available and affordable. So it is more a question of organization and willpower. Countries like you and me pair up and make this happen, and save millions of lives, and make the population of these countries more productive when they grow up.
And it saves countries money in the long run.
It saves, it's the best investment that you can make, in fact.
Let's talk about the infant mortality rate around the world. Have we been making progress in that?
We have been making progress in most countries, in particular in Asia. It's fantastic what's happening there. Look, for example, at life expectancy in countries like Vietnam, Malaysia. They're far higher than Poland, Russia, Turkey. They're really doing well. Africa is a problem. Africa is lagging behind, and the mortality rate there is deplorably high. And so it's there that we need to really use the resources and the organizational skills that we possess today to really get at these appalling numbers.
Ambassador Weltand, thank you for speaking with us today.
Thank you.